could you tell us why you chose cancer cachexia as your research area?
Hi, Lydia, and hello, everyone. Nice to see you. Thank you for this precious opportunity of the interview in APJON. I have worked for more than 15 years as a thoracic medical oncologist and handled chemotherapy, radiotherapy, and supportive or palliative care for patients with advanced lung cancer or mesothelioma. Although medical oncology has advanced considerably and prognosis has improved, I realized that prolonging life through cancer treatment does not necessarily contribute to the patient's quality of life. Cancer-associated weight loss, or cancer cachexia, is a wasting condition experienced by 80% of cancer patients and never improved by chemotherapy. It has no standard treatment at this time and becomes a major cause of decreasing physical function and the quality of life. So that's why I choose cancer cachexia as my life work. Thank you.
Thank you very much, Dr. Naito. And the second question for you is, could you describe your findings from your research on cancer cachexia and its significance?
Cancer cachexia is present not only in the terminal stage of cancer, but also in nearly half of the patients with advanced lung cancer from the early stage of the cancer journey, such as at the time of initial diagnosis. A large body of evidences this demonstrates that baseline weight loss in cancer patients, including advanced lung cancer, increased toxicity of chemotherapy, decreased efficacy of the chemotherapy, decreased quality of life, and shortened survival time. Besides, our research has shown that cancer cachexia reduces physical function, develops a disability, increases hospital stays, and increased healthcare costs. Moreover, many patients with cancer cachexia have a psychological burden and are socially isolated. This is rarely discussed in the medical community. Therefore, prevention or treatment of cancer cachexia may improve these outcomes. Thank you.
Thank you very much. And the third question for you, Dr. Naito, is, would you mind discussing with us your insightful experience in cancer cachexia research?
For the past 7 years, we have working to develop a multidisciplinary treatment for elderly patients with lung or pancreatic cancer who are at risk of cancer cachexia, which we call the NEXTAC study. Our intervention combined nutritional counseling by dietitian, home-based resistance training by physiotherapists, and physical activity promotive counseling by nurses. We monitor the patient's physical activity with accelerometers. The phase 1 study showed a good compliance and adherence over 90%. In the next randomized phase 2 study, disability was the primary endpoint, but unfortunately it could not shown to prolong disability-free survival. We saw that the non-pharmacological therapy alone may not be enough to improve cancer cachexia. Therefore, we are now studying the combination of our multidisciplinary treatment with the recent approved drug, anamorin, in Japan. And thank you.
Thank you. And the fourth question is, in your opinion, what will be the future hotspots for research on cancer cachexia?
The pathophysiology of cancer cachexia has recently been uncovered, and new biomarkers and therapeutic agents are being identified one after another. Future clinical studies are expected to develop effective drug therapy following anamorin. However, cancer cachexia is quite challenging. Both pharmacological and non-pharmacological treatments are insufficient on their own. Therefore, it will be important to combine, as I mentioned before, combine pharmacological and non-pharmacological treatment in the future. It is important. Also, intervention methods for psychosocial burden still need to be standardized. These may be maybe a future hotspot from my view. Thank you.
Your articles are cited by a number of authors from around the world. And what do you think is the significance of having more studies in this area on this topic?
Based on the results of a global survey of healthcare professionals, many healthcare providers have given up on treatment of cachexia because they understand cancer cachexia to be an inevitable condition. Many medical professionals do not know the exact diagnostic criteria. So biomarkers and treatment options development has been delayed so far. Furthermore, since cancer cachexia is a multifactorial disease, it is necessary to integrate evidence, including nutrition, exercise, pharmacotherapy, and psychosocial support. So we need more research by many researchers to integrate it into one treatment. Thank you.
And our last question today is, could you share with us your view of APJON's 2023 special issue on cancer cachexia?
We planned an APJON special issue 2023 titled Cancer Cachexia Multidisciplinary Care. As I mentioned, the cancer cachexia is a multifactorial disease, and the combination of non-pharmacologic with pharmacologic intervention is essential. But it remains an unfinished puzzle. So in this special issue, we call for original articles, case reports, or reviews that shed light on these multi-faced unmet needs in cancer cachexia care. Contributors will be from many fields, including nurses, dietitians, physical therapists, occupational therapists, psychotherapists, social workers, physicians, and pharmacists. We invite you to submit your unique and outstanding papers to help us further discuss new models of multidisciplinary care for cancer cachexia. We look forward to receiving your valuable submission. Thank you.
Thank you, Dr. Naito. We also wish you success to this special issue on cancer cachexia in 2023. And thank you again for taking time off your busy schedule.